What about the recovery? I mean, that's obviously another big question people have. What is the recovery like? And obviously it differs from person to person also.
Yeah, with the average knee, once the surgery is done, and the surgery, again, you're maybe in the hospital for 1 or 2 nights. You're typically doing home therapy or outpatient therapy your first 4 weeks. I see every one of my patients right around the 4-week mark, and they're typically back to driving, off of their walker and cane, doing everyday walking and going out to dinner. And they continually improve with that knee for the first full year. But they can do pretty high level stuff usually by the 6th to 8th week.
So this is not ever done outpatient. You spend a night in the hospital when you get your joint replaced.
Typically right now the Medicare codes are inpatient only. So you have to stay one night for Medicare. There's kind of a little push towards doing outpatient joint replacement. Over the last 5 years, those numbers have gone up significantly, basically to try to keep people out of the hospitals and get them back to their home as quickly as possible. I think there's benefits to that, going home right away, and there's disadvantages to that as well.
What do you hear from your patients the most in the wake of this procedure? Is there a common thing that you hear from them first? Their reaction to the procedure, mentally and physically?
I mean, the initial, first day after surgery when I visit patients, I probably would say more commonly I'll hear that it's not as bad as they think it is. They're doing better than they thought they would do. And they do overall better than they imagined.
But at that point, do they still have some medication in their knee that blocks some of the pain?
No. The first day you may have a nerve block that may help your pain, but after even the first 2 to 3 weeks, I mean, people can get pretty comfortable with oral medications and elevating and icing. And that's, as a patient, your job, your first few weeks is to keep the knee safe, to keep the incision clean and dry. The more patients ice and elevate that leg, the better it will feel, and they'll get better faster following what we prescribe for them as opposed to overdoing it and doing too much too soon. Patients that get into trouble try to do a little too much too soon, and I think they swell and they hurt a little bit more.